Hi, I'm Dr. Cassie from Vetfolio and the host of Vet2Vet. Today we're having a candid conversation about safety culture and discussing what role veterinarians have in creating an environment where safety and compassion for our patients, for our clients, and for our colleagues is always top of mind. Joining me is Dr. Scott Shaw, Director of Patient Safety for VCA Animal Hospitals. Thank you so much for being here, Dr. Shaw.
Thanks for having me. I'm really excited to talk more about patient safety today. I think that patient safety is something that affects all of us. I still remember a case from when I was a brand new veterinarian, back in 1999, just like it was yesterday, where I made some mistakes that really affected the patient and the owners and my teammates. And briefly, it was a dog that came in seizuring from hypoglycemia. As veterinarians, we think, oh, this is something we see all the time. And it was busy, there was a lot going on, and the technician shows me some blood work, and I look at it and I say, oh, his blood glucose is 32. Let's treat that. But I missed that his potassium was also 8, and his sodium was low. And, as you hear those pieces, you start to think, well, this dog was clearly Addisonian.
Right.
But I just missed it. And, ultimately that dog actually died from hypoglycemia despite us treating it because all he really needed was some steroids. And, I was really blaming myself. And when you really step back and looked at it, there was so much going on in that moment, right? We had just finished up a CPR. We had 3 other patients waiting, one of whom was really critical. Somebody handed me one of those little crumpled pieces of paper that we used to get out of the blood machines with the thermal printers, right? That you could barely read. And when you put all that together, I was set up to make that mistake, right? And, with 30 years later, I could think about it and realize it. But at the time, it was devastating for me and, really upsetting for the team. Mistakes like that happen every day in our hospitals and every day throughout the world in veterinary medicine and human medicine for that matter. And so I think that really and truly what we need to start thinking about is how do we prevent ourselves from getting into those situations where we're really set up to make mistakes? And that's really what my goal is as I really try to champion patient safety in veterinary medicine.
I love that, just kind of creating that culture where you're set up for success. I think we all have stories like that of, I just missed it. If I just would have done something different, if this miscommunication didn't happen. And like you said, it's devastating when it happens. It's something we carry with us for our entire careers. So I'm so glad that you are where you are and, taking these steps to help all of us avoid these mistakes in the future. So we're all humans and we all make mistakes. If we take that as a given, what do you feel like we need to do to make sure that we're doing all we can to create a strong safety culture?
Yeah, a safety culture is really about systems that protect us from ourselves. As human beings, we make mistakes, right? We've all heard the saying, to err is human, and it's very, very true. No matter how smart you are, how hard you work, think about just a simple decimal place error, right? What veterinary professional hasn't accidentally written, I want to give 10 mils of cefazolin instead of 1 mil of cefazolin.
Sure.
And it's just your brain moves a decimal and your brain doesn't catch it and your brain's not really designed to catch it. And so no matter how smart you are, right? Every veterinarian clearly passed math somewhere along the way before they got into veterinary school. Those mistakes are going to happen. So then what we need to do is we really have to think about a systems-based approach. And when we think about patient safety, we don't think about it as blaming the people that make mistakes. In fact, our goal is what we call a no-blame culture, where we can openly talk about the mistakes that we make so we can learn from them. Mm-hmm. And it's not about admonishing the people that make mistakes. It's about asking the question, what can we do to prevent you from making that mistake the next time?
Sure.
So when you think about the system and you build the system to protect us from ourselves, you can really make a significant advance in patient safety.
I think that makes a lot of sense. I mean, as veterinarians, we care. We're, detail oriented and highly empathetic, and all we want is the best outcomes for our clients and our patients. So like you said, very rarely is it going to be a careless error. Usually there's, I would imagine, something that played into that error happening.
Yeah, absolutely. I always say that nobody comes to work wanting to make a mistake, right? Nobody comes to work saying, I don't really care if I make a mistake that hurts a cat or a dog today. There's just nobody like that in our field, right? We're all caring, compassionate people. And when those mistakes happen, they're devastating. I've literally had to talk people out of quitting their jobs, when they've been part of a medical error that harmed a patient, because it's so antithetical to who we are as veterinary professionals.
Absolutely, absolutely. It's hard to bounce back from that. Speaking both from up here and then, also from a personal standpoint, because I think these things have happened to all of us, myself included. Can you give me an example of where a system could be changed to help set someone up for success?
Yeah, there's one really common one, which happens in many, many veterinary hospitals. Think about the drugs Convinia and Cerenia, that many people choose to store them both in the fridge. One has to be in the fridge, one we choose to store in the fridge. The names sound pretty alike. They both start with C, they end in IAA. And if you look at their bottles, they're actually like various shades of greens and purples, and they sort of look the same. And I bet you if you walk into most veterinary hospitals or many veterinary hospitals and open up a refrigerator, they're sitting right next to each other. And I suspect that many people, myself included, have been part of an event where somebody accidentally got a dose of Cerenia when they meant to get a dose of Convinia, or vice versa.
Sure.
And luckily, it's what we call a no harm event. The doses in the appropriate weights, assuming you're doing your math correctly, you're not going to hurt somebody by giving them an extra dose of Cerenia or an extra dose of Convinia. But it's a good example of how patient safety events can happen. And so now you say, well, what can we do to prevent that mistake? Well, the answer isn't just keep on reminding people that they should double check Convinia versus Cerenia, because we're busy and we grab things and we work from memory of where things used to be. Yeah, but you can do things like wrap one of the boxes in bright colored vet wrap, right? So everybody knows that the Convinia is always wrapped in fluorescent green vet wrap, and that's all it takes. So things like using consistent labeling, different colored labels for different drugs, all those kinds of things. If you can set up the system so that it's very visually obvious, this is this dog's drugs, here's his pre-med, here's his induction agent, here's his antibiotic, and you don't have to go look at like little handwriting that somebody is, what does that say? Cefazolin, or, and you just don't know. And so if you can set up a system where you're doing that really consistently within your hospital, you can really eliminate a lot of those mistakes.
And I'm thinking even with Convinia and Cerenia, even like the volume that you give is the same, because that's one way I'll double check myself sometimes is, does this volume seem appropriate? But even those, like the volume is exactly the same.
Pretty close, yeah.
And I can absolutely relate to like squinting at syringes with Sharpie on, going like, what is in there? So that makes sense, having these systems in place to avoid confusion. Clear communication is another thing that really plays into this. I mean, just saying Convinia and Cerenia, of course, in a noisy clinic, somebody could mishear those. So what processes do you recommend to prevent confusion in verbal communication?
So one thing that you can do is just use the generic names in your hospital really, really consistently. Most of us were forced to use them in vet school and then got away with it because they're not as easy to use as the trade names. But the trade names a lot of times can be very similar because they sound nice, and that they were chosen for that reason. Versus the generic names, they have certain formulas of naming that they have to follow, and so that can be really, really helpful. The other thing that can be really helpful is using what's called closed loop communication. If somebody asks you for something, immediately repeat back what they asked you for, right? Can I have 0.2 cc's of epinephrine? The immediate response should be 0.22 cc's of epinephrine. Here you go. And so there's an opportunity then for me to hear you saying back to make sure that you heard exactly what I said and we're on the same page. And if you ever have an opportunity to watch a cockpit in an airplane, that's exactly how they communicate. The other thing to be very careful of is just verbal orders in general. There are times when it's hard not to give verbal orders during CPR, for example. But aside from true emergencies, it is far better to write down orders because it eliminates the chance of somebody misunderstanding what you say. It also makes sure that you say what you mean, because I know my wife will tell you I frequently don't say what I mean. But when you write it down, it's much clearer for people. By using closed loop communication when you're using verbal orders, or even better, using written orders, you can really eliminate a lot of the communication-based mistakes, which can be very, very impactful.
Absolutely, and we're taught to use closed-loop communication in CPR because that depends on verbal orders. So it makes sense to use that in other situations. And absolutely, the written orders make sense as well, even if it means standing there with one of the nurses while we put it all into the computer, then it's written down.
I think that's exactly how you do it. Is you write it down, you have a standard format, whether it's typing it in the computer, it's putting on a treatment sheet, whatever works for your hospital. And the nurses are empowered to say, well, I can't really go do that until you write it down.
Yes.
Because that's a piece of it. Because as veterinarians, we get busy. We're like, oh, just go do this for me, this once. And it's that once that the mistake's going to happen. And so the flip side of this is empowering your team to stand up for patient safety. And so for the nurses to say, I just really need you to write this down before I go and do it, can be a huge step forward in patient safety, because that'll help change the culture where we don't even ask. We just write it down and like, all right, here's all the medication orders for this patient, rather than he needs this and he needs this and he needs this. And if you have really easy to use forms and easy to use systems, it doesn't take any longer because it's all done. It's done right the first time, and there aren't any more questions.
Absolutely, absolutely. I have to agree with that from what I've seen in practice, that it doesn't seem to be any less efficient to do things in a written and closed loop type of manner.
Yeah, absolutely.
Another factor leading to patient safety incidents is time. Definitely something we seem to have less and less of thanks to staff shortages and increasing number of patients. So how does that play into these mistakes in creating a good patient safety culture?
Yeah. So many of the mistakes that we see are a result of not enough staff, not enough time, people rushing, too many patients that need to be cared for. A couple of things can really make a difference there, right? It'd be easy to say, well, we need more staff, but that doesn't really happen in our world. But what can we do? One of them is to make sure that you do take safety pauses. A great example of this is surgery. So in the operating room, you're getting ready to do, a surgery. You're taking a lump off of a dog, something really straightforward. You've done it, dog's anesthetized. Right before you're ready to start the surgery, take 10 seconds and get everybody on the same page, right? This is Fluffy. She also has kidney disease, so let's be sure that we're keeping up with her fluids while she's under anesthesia. We're going to make sure that it's the right patient, it's the right surgery, that this is the lump that the owner wanted us to take off, because probably we've all taken off the wrong lump or seen that happen. So let's confirm that we're doing the right surgery in the right location, and make sure that anything that's needed in terms of pain medication, perioperative antibiotics, right? All those things, you just sort of go through them quickly. You can do that in the form of a checklist, which is a great way to make sure that everything gets taken care of. And there's some really good examples of perioperative checklists out there for veterinary medicine. If you can do things like that consistently, you can really prevent mistakes before they happen.
And it makes so much sense, because when you're busy, it can be frustrating to say, okay, everybody stop and pause for a minute. But the 10 seconds you spend on the front end will save you a whole lot of time on the back end, should, God forbid, a mistake be made. And especially when we're talking about surgery.
Yeah, and you can take that outside of surgery even. You can think about it in the concept of a huddle, right? One of the things that I'll do sometimes with my team, the crazier it gets, is I'll be like, all right, everybody, huddle up for a minute. And that huddle is your opportunity for somebody to speak up and raise a patient concern that just hasn't made it to your radar yet. Something we see all the time in the emergency room, for example, where we'll be trying to prioritize, and one of the nurses will say something along the lines of, I've got a patient out front. It's not that sick, but it's kind of sick, and I don't want it to wait too long. Can we move it up a little bit, or can you just take a quick look and make sure it's okay? Versus me just keeping bulldozing through my day, and this dog or cat sitting out front, and it's maybe sicker than we've given it credit for. And 4 or 5 hours I get to see it. This is a short 30-second, 1-minute chance. Pull everybody together. The more chaotic it is, the more helpful those 30-second pauses to refocus everybody really can be.
Absolutely. Just get everybody back on the same page and make sure everybody's moving forward together instead of in a fragmented way that's going to be inefficient and unsafe.
Yeah. It's also a way just to tell everybody they're doing a good job. Sometimes when it gets busy, we all feel like we're not doing a good job, right? Your stress level goes through the roof on those days.
Mm-hmm.
I know mine certainly does. And so it's a good opportunity to tell everybody it's okay. We'll figure it out. We'll get through it. We're not failing, right? There's just a lot going on.
Sure.
And I think it helps people stop, internalizing those feelings sometimes, which can be really good for the team as well.
And I feel, stop internalizing the feelings, and that positivity is probably good for patient safety as well.
Absolutely, right? If people are focused on their job, they're enjoying their job, they're not just going through the motion of checking boxes, right? Giving people that pause moment in a huddle can help them refocus on doing their jobs.
It's amazing how much of just a mental component there is with all of this.
Our job is 99% mental, right?
Mental gymnastics.
Yeah, the physical skills are the easy part, right? Learning to tie a knot or learning to put it in an IV catheter. Those are the easy parts of the job.
Right.
Anybody can learn those things. It is the mental part of anticipating your patient's needs and doing it in a manner that promotes safety that is really the hard part of the job.
Absolutely, absolutely. So we all want to be perfect all the time, but unfortunately mistakes will happen. And I think one of the toughest things to do is when a mistake does happen to then go back to your client and explain what happened. So do you have some good tips for effectively communicating with clients in the unfortunate event that there is a medical error?
Yeah, I think honesty is always the best policy, even if it was a no harm event, because it's in there, it's in the record, somebody can notice it. And there's great data from human malpractice litigation that shows that when the practitioner is immediately honest, look, we made a mistake, here's what happened, here's why it happened, here's what we're doing to prevent it from happening in the future, the chance of litigation is actually far less than if they try to sort of brush it under the rug and not tell anybody, and then it comes up later. And so I'm a big believer that letting your clients know that we made a mistake. And what I find clients really, really want to hear is what I'm going to do to try to keep it from happening again in the future. You know, we're really lucky. The vast majority of mistakes that occur day to day in our hospitals are what we call no harm events, right? They're like this Faslin and Serenia mix up. They don't cause any significant harm to the patient, or they cause very short term, but we can learn from them. And that's what clients want to hear, right? We made it, there was a mistake, your dog's fine, but we're going to learn from it. We're going to design the systems so that these events don't happen again in the future. And if you're honest with people and they hear that from you, I won't say never, because sometimes it'll cause you problems, but more often than not, that's really what people want to hear.
Absolutely, to take responsibility and do what we can to make it right for their pet, and then prevent it from happening again in the future.
Yeah,
Makes
exactly.
a lot of sense.
Exactly.
You also promote the idea of encouraging everyone in the clinic to practice compassionate care. Can you explain what that means?
Yeah, I think that the idea of compassionate care is that we need to take a moment again and really think about what our patients need. From not only from a safety perspective, but just from a being comfortable and being healthy perspective. And all too often, especially in the current world, we're so busy, we're just trying to get through our day. We're trying to see as many patients as we can. We're trying to help as many patients as we can. And we've lost focus on that piece. And I think what's really important is that we all got into this profession because we're compassionate people. It's what feeds our fire, right?
Absolutely.
It is what we really enjoy about being veterinarians and veterinary professionals. When you lose that, you lose sort of that level of attention to detail, and you lose the ability to notice subtle changes in your patient because you're just getting through your day.
Right.
And what happens is the small problem that you could have addressed today becomes the much bigger problem for the dog or the cat tomorrow. Making sure that people are taking that moment to really think about their patients, make sure that they're comfortable, right?
Yeah.
That they've got that extra blanket, or they're warm, or all those things. When you're taking time to interact with your patient like that, you're going to notice subtle things that will allow us to provide better care. And I think that's where the huddle and reminding people of those pieces can all tie together. But it is a part I worry that we've lost a little bit over the last couple of years in veterinary
With the
medicine.
busyness.
Absolutely.
So I will say I 100% agree with you, because I'm thinking both in the exam room and in the house call setting, I always kind of joke around. I say it's amazing what you can talk animals into letting you do. You're like, I'm going to do it. And you're like, all right, fine. But it makes so much sense, this compassionate care that you're talking about, because if the animal is comfortable, they're not going to hide things from you as much either. They're going to be more willing to tell you what's going on and let you notice these things, rather than, us being busy and maybe rushing through, or like you said, just trying to get through our day and not noticing. But also, if the animal feels that off of us, they're probably going to be less willing to let us know if something hurts or if something's wrong.
Absolutely. As a doctor who worked in an inpatient setting most of his life, right? The more people have their hands on the animals, the more that they're interacting with them. It's why the owners notice things that we don't notice, right? They're with them all the time.
Right.
You think about your own pets, right? All the things that you notice that you wouldn't notice just in an exam room setting. And so, but if you're really tuned into those things, particularly in patients you're seeing regularly, it can really make a difference in your ability to anticipate their needs.
I feel like that's kind of where we keep circling back to, is take that little bit of extra time in the beginning to save all the headache and heartache and time on the back end.
Yeah, I think that's exactly it. And I think I 100% understand that it's hard, right? Because it means that
it sounds simple.
Hey, it totally sounds simple, right? But it's hard to do in the moment when everything's happening around you. And so that's why, if you can, every time you talk to a client, is there anything else you think your pet needs from me today, right? If you just ask that question, they're the experts in their animal. They'll tell you, right? And that's a question I always ask sort of as I'm wrapping up an exam is there anything else you think your pet needs from me today?
Absolutely. I love that phrasing. What else does your pet, or is there anything else you think your pet needs from me today? That's such good phrasing.
Yeah, and people respond to it.
Absolutely. Absolutely. We keep the focus on the pet rather than, do you have any questions, or what questions do you have for me? Like, well, I don't have any questions, because the focus is on the pet.
Yeah, right. It's what does the pet need?
Sure.
And if you're talking about a complicated medical procedure, it totally makes sense to say, what questions do you have for me?
Sure.
But when you're really just like, dog looks pretty healthy to me, I just want to make sure there's nothing I'm missing in your eyes. I think that's a good way to ask that question.
I love it. I love it. So, like you said, to err is human, and sometimes errors will happen even when there's safety systems in place. Can you give us an example of that?
Yeah, absolutely. We had a series of incidents, one of which I'll tell you about, where we had some heating pads malfunction. So it was an equipment issue. It took us a little while to figure out it was an equipment issue, but we had one patient in particular that I think about, who was a dog who was having a ventral slot, so big neck surgery, long recovery, and he had a really, really significant burn on his back from a malfunctioning heating blanket. It wasn't obvious that that's what it was to begin with, and it wasn't obvious that there was a malfunction. We looked at all the, did people do things improperly? Did they use things that they shouldn't have for heating, which can cause problems, at times? But they didn't. They did everything right? They used an approved heating device with, they used it properly. And this was an equipment malfunction. And it turns out we found a pattern of this particular piece of equipment malfunctioning. You have to step past the people, and really even look at the mechanical systems that you use every day in your hospital.
Sure, sure. Oh, it's such a scary reminder that things can go wrong, even when you do everything right. But a good reminder to be on the lookout for those things.
Absolutely. I think that building the culture is the first step. And when I think of a safety culture, I think of what I call a no-blame culture. It's a culture where it's not about, Sally made a mistake. She didn't realize dogs don't get 9 mils of buprenorphine. She realized that they only get 0.9 mils of buprenorphine, right? Really, you have to think about it from that sort of lowest common denominator. The least experienced person needs to be successful. Mm-hmm. Imagine if you got in an airplane and you had a new pilot, and you're like, he may crash the plane, he might not crash the plane, we'll see how it goes today. That wouldn't be okay.
No.
So how do they build systems around that pilot who's still new, right? And there's certainly advantages to experience, but how do they build systems around that person that they're able to operate safely every day? And that's the way we really have to think about it. So just blaming people for making mistakes doesn't work. What we really need to think about is how holistically do we make sure that people aren't in that position, right? That she's got some training, but you can't train about every medication in every situation. That's not realistic. So how do you keep people from making math mistakes? Well, you don't do math. So one of the things that I really would like to get away from is people pulling out their calculators and doing math. We have computers. They will do math for you. They will not make mistakes. They will give you the right answer. And so all you have to do is correctly put in the dog's body weight. And any drug can be calculated in a spreadsheet. CRIs are a great example of that, right? So you're calculating a CRI, maybe a lidocaine CRI, lidocaine ketamine CRI that you're going to use under anesthesia. And you go, I'm pretty sure I don't put 50 mils of ketamine in there, right? And you say, okay, let me do that math again. But really the answer isn't let me do the math again. The answer is prevent me from doing math in the first place.
Sure.
Which sounds remedial, but at its core, it's really building a system, right? You build a spreadsheet, it does what you need. There's plenty of them available if you go searching through the online resources. And it will give you all the information that you need in order to be able to prescribe drugs. And then from there, you start to think, well, now our other problem is we tend to give the wrong drugs to the wrong patients sometimes. That's a common one that we see. So what systems can I build, right? That help with that. Do dogs and cats have name tags on in your hospital, right? And you start to think about all those things, but it's never about, I'm just going to tell people to do a better job, right? As a leader, when you're pushing safety, that's where you're going to make a mistake. When you say, well, I'm going to at the next staff meeting tell everybody to pay more attention and make sure they give drugs to the right patient. What does that accomplish?
We're all trying to do that.
No, nobody's trying to make a mistake, right? And a lot of times the people making mistakes are sometimes your best employees, right? They're not even the new person who just made an honest mistake because of the lack of experience, right? They're just people trying to do a good job. They're busy and they're rushing and they make mistakes. So what can we build in terms of medications, right? Orders. Are the orders written clearly? Are the orders written or are they verbal, right? are people writing things like 8.0 mils, right? That's, we'll learn this in school, but that's not a good way to write it because it's very easy to miss the little point, and all of a sudden you look at 80 and you go and give, 80 milligrams of drug instead of 8. Are you using a leading zero, so 0.8? So are people consistently doing those things in the way that they write orders? And one of the challenges is that it's a lot more writing, so people don't like to do that, right? Are they writing with the milligrams and the mils? And then is somebody double checking that math if you're doing math? As you start to think about all those little things, in just one staff meeting, you could probably come up with 3 or 4 or 5 things that are relatively easy to implement that can make a difference in terms of the safety of your patient. And so I think that that's really the commitment that we need to make. Patient safety takes time, right? Operating unsafely is quicker and easier, but ultimately on the backside comes with some serious consequences, right? And so we have to commit on the front side to we're going to design systems that we know take a little bit more time, but are going to really make a difference in the long run for us. And then we're going to commit to living to those systems. Because what is the first thing people do when they're busy?
They throw the system
out.
Side
They don't do the checklist, right? And all of a sudden they miss something, and they don't pressure check the anesthesia machine, and the pop-off valve's closed, and then you've got a whole other problem going on. And so a commitment to that, in human healthcare and aviation, I think of it as just an institutional commitment to safety, right? That's the number one priority. Or we're in Orlando, right? In Disney, if you look at their keys, their number one key is safety. And so everything has to come after safety, which in that environment totally makes sense. But we really need to think the same way, right? We have to treat our patients safely. We have to treat them with quality medicine. But you got to treat them safely first, because no matter how good a doctor you are, if you're working in an environment where there are mistakes, you're not going to be helping your patients.
Yeah, you're just not set up for success in that environment.
Absolutely.
Well, Dr. Shaw, thank you so much for being here today. I mean, these are great examples, both of areas where errors can occur, but also systems that we can put in place that are relatively simple in order to help prevent them. And just a good reminder to, like you said, put in that time on the front end to really save a lot of headache and heartache on the back end. So thank you so much for being here. Any final thoughts you'd like to share with us?
I'd just like to say safety starts with everybody, and you really have to make little steps. It is not an overnight transition, but if you can make that commitment within your hospital, over time you can make a huge difference.
I love it. I love it. Well, thank you again.
Thanks for having me.
And thank you to Mars Veterinary Health for sponsoring this edition of Vet2Vet. We hope to see you back for our next in-depth discussion. And remember, if one animal is better off because of you today, it's a great day.